You can see how advantageous Isolite is throughout the entire CEREC procedure. The first thing we do is lubricate the lips. The back end of the Isolite mouthpiece is already moistened, so this is just going to slip right into place. As you can see, in about 3 seconds, we're ready to go. We are retracting the cheek for camera purposes. We are utilizing the Isolite vacuum light pipe as the fourth finger rest for our hand. We can look and see all the porcelain is fractured. When removing the crown, they are sometimes a little difficult. They can pop off with force, and you can see that it's not going down the throat because the throat is totally protected. Now we remove the crown. Now the assistant will go back in with the additional HVE suction and suction the tiny particles. Now we have a clean working field. Notice during preparation you do not need to worry about the tongue and can concentrate entirely on your procedure. Notice that the assistant does not have to be chained to the chair to retract and aspirate. This allows the assistant to stay one step ahead, allowing the procedure to go much faster. We could actually leave the room while the assistant is placing the retraction cord. This is one of the benefits of Isolite. We are now ready to take the antagonist bite for the CEREC. Now we place the Isolite and make sure everything is dry. Then we can powder and image the quadrant. If we were in the other room, the assistant could also take the antagonist impressions. Now we're removing the antagonist and putting the mouthpiece back in. Wash all the powder off. We'll remove the retraction cord and evaluate if our margin is correct. We can see all our margins perfectly while powdering. We are ready for imaging. The total lab time for milling, polishing, and staining and glazing is going to be about 30 minutes. We've finished custom staining and glazing the CEREC crown, and now we're ready to cement. We place the Isolite in the mouth and dry everything off. Now it's time to bond. Finally, we can cement the new crown. Isolite is aspirating and retracting, so the dental assistant can be mixing and loading the restorations and handing the instruments. After cementation, we can take the mouthpiece out.